So how do we change things? Well, we can change it. Someone else can't do it for us. We have to reduce our portion size. You know, we eat till we're full. Wrong concept. We need to eat an amount. When we're done eating, if we wait, we'll be full. So eat slower makes you full quicker. This is critical. And I'm guilty of this, right? Right before you go to bed, David Letterman's on, you're sneaking around the house looking for a little bit of chocolate. Bad, right? And if you have reflux, this is really bad. Because then you go lie down, and 1 o'clock in the morning, you're up pacing the hallway because you got heartburn. So this is probably the biggest no-no. Don't eat within 2 or 3 hours of going to bed. But we all do it. You need to have like a timed lock on the refrigerator, right? So it kind of locks down at like 8 o'clock and you don't get access till like 6 a.m. Eat slowly, like we talked about. Smoking, big inducer of reflux. Why? Because it lowers your pressure at the lower esophageal sphincter and makes you more likely to have acid reflux. Alcohol, it's Wisconsin. This is hard to decrease here. But if some people know that this makes them reflux, you have to stop it. Excess weight, we're always working on that. Again, makes a big difference. And I put your stress thing in right here, okay? So let's talk about how do we treat this? Well, we can use antacids, right? Everybody has Tums in their closet. Everybody has reflux, has Tums in their closet. Mylanta, Maalox, Riopans, all bunch of different ones. They even have ones, I think, no-name brand, acid reducer. What I want you to keep in the back of your mind is, what are all these things doing, right? What they're doing is decreasing the acid in the stomach. They're not stopping that stuff from coming up, right? But they're decreasing the acid in the stomach. And all these things were not invented to treat heartburn. They were invented to treat to treat ulcers. It just so happens they also help with heartburn. There are medications that treat heartburn, but there are no medications that treat reflux. Why? Remember what I talked about. Reflux is the physical movement of gastric contents up into your esophagus. There is no drug in the world that will stop this stuff coming up and paying you a visit, if that's the way your anatomy works. Nothing. You can stop it a little bit, but there's no medication that will stop it. There is medication that will make it feel better. Okay? But that medication always has a price, meaning there's always side effects from medication. And what is the long-term sequela of being on acid suppression? We don't know. We'll probably find out in a few years. So how do we evaluate people? When people come in with reflux, we talk to them. We always look down there because we want to see, is there damage? Is there something else? Something else is what? That's the big C word, right? Is the cancer there? Why is that a problem? I give the same example every time I give this presentation, which is about 4 years ago now. I had a 45-year-old gentleman from Freeport, came up here, and his story was that he had trouble swallowing. But he'd been on his story had been on Prilosec for 10 years. And every year, just got his prescription refilled, and he was happy. Didn't have any heartburn. He was happy as a lark, fine. All of a sudden, one day, he started having trouble swallowing. And then he couldn't swallow. So he came in to be seen. We looked down there. He had esophageal cancer. He never saw his 46th birthday. Okay? So if you're being treated for reflux, we got to make sure, medications, the medication didn't cause him to get cancer, but the medication covered up the fact that he had a problem. So, if you got a brain tumor, gives you a headache, taking Tylenol is great, takes away the headache, but it doesn't take away the underlying problem. So it's just important to make sure that before we put on strong medications, we know what we're treating. I'm sure there's people in this room that take blood pressure medication. You go see your doctor, they renew your medication, but I bet they take your blood pressure. I bet there's people in this room who are taking anti-reflux medication for heartburn. And I'm willing to bet there's people in this room who are on medication who have never been checked to make sure there's not a problem. Just, you got to look at what's the right thing to do to make sure everybody's okay. So we're going to talk a little bit about the small group of people that have reflux to the point where they can't tolerate it anymore. And these are the people who really, they lie down at night and up comes dinner that they ate 4 hours ago. Or they have such bad heartburn they can't function during the daytime. Or they have chronic asthma from reflux. They wake up choking. These are the people who really benefit from doing something. And in them, you actually have to do an operation that stops the acid coming up. It does not stop the acid, it just stops it from coming up. We've got to remember that the acid's in the stomach for a reason. You want acid in your stomach, but you want it to stay in the stomach, right? So what are our goals with surgery? Again, we're talking about the small group now who need surgery. Our goal is fix their symptoms, take care of the heartburn, fix the hernia if they have it. If they have an esophageal problem, let it heal. Don't let it get worse, and don't let it come back. Pretty simple goals. And I'll be honest with you, they're not all achievable. We're happy if we can get 3 or 4 of these. So the operation I'm going to show you is called a Nissen fundoplication. It's an operation that we do laparoscopically. We actually take the top of the stomach or the fundus of the stomach and we wrap it around the lower part of the esophagus. And that actually will stop acid from coming up. So does it work? It works actually very well on the correct people to have it done. So one of the things we do is we really check to make sure the right people are having the right operation. People have the operation, they go home the next morning. Most people are going to have trouble swallowing in the first week. I want them to have trouble swallowing, because if you're having trouble with the food going down, it's going to have a hell of a time coming back up. And that's what you want to prevent, right? You want to prevent the stuff from coming back up. Reoperation is very rare. We do about 60 of these operations a year, times 18 years. That's what, about 1,200 people? I've just seen my first person who may need a reoperation. So that's about 0.01%, about 1 in 1,000. So it's a lot less than the national statistics of 1%. Surgery is still works the best, most efficient, and gives us the best patient satisfaction.